So hi, my name's Nick Bennett. I'm the division head for infectious diseases. I'm afraid I couldn't be there with you today, but I really wanted to send you a message and tell you a bit about how important this project is to me and my division and my patients, and how happy I am and excited that you guys are going to be helping us with this. And I want to thank you for your time. Thank you for everything you're going to do for us. This infusion center is going to mean a lot to the division of infectious disease and immunology. We are a growing division. Our infusions for kids with immune deficiencies have basically quadrupled in the last few years. And we've been playing catch as catch can with our infusion locations. We have patients who are seen in outpatient areas, patients who are seen on the inpatient units. It's not ideal. So we're stealing resources from other people who probably need them more than our patients do for different reasons. We need a dedicated place where we have dedicated infusion nurses and dedicated time because my infusions take a long time. So the kids that I see are primarily diagnosed with primary immune deficiencies. These are lifelong conditions, they're life-threatening conditions. And we treat them with immune globulin infusions. Now, immune globulin, it takes a long time to go in. You're looking at 6 hours or so for an infusion. 4 hours if you're lucky, and some of them go longer than 8 hours. And so this is not something where the kids are in and out. This is something where it's an all-day procedure. There's lots of interventions. You're looking at nursing care every 15, 20 minutes or so. And that's a lot to ask of the families as well. The families who come in have to take days off work, which they're burning through. They're trying to get work done during the time they're in the hospital with their kids, and it's very difficult. And we have kids who really suffer from that, from the treatments we give them, both physically and mentally. And the mental health aspect of this is one thing that I feel very strongly about. We want to build an environment that's safe for them, that's good for them. They have child life specialists available where they're not medicalized. They are not CVID kids. They are kids who happen to have CVID, common variable immune deficiency. So we want them to feel more like kids and be able to act more like kids in a different place than a hospital bed, really. I have so many stories that I could share with you. I have kids who have come from being found on their kitchen floor, unresponsive, sick, dying in their mother's arms practically, and we've been able to put them back into a normal lifestyle where their only visit to the emergency room is because they fell over and hurt their ankle while cycling. I mean, that's literally what's happened with one of my patients. I have patients who are in, as I said, for 8 hours or more with significant drug reactions and allergies, where they need this dedicated care. And it's difficult to have these kids managed on the inpatient unit where you have nurses who are dealing with 3 or 4 other patients who really need their help too. And my infusion kids are impinging on that. And then we have kids where the child's care is relatively easy. They sit in the crib and they get their infusion and they watch a cartoon on the TV, and that's fine. But dad is there and he's trying to do his office work. He's trying to get his laptop on his meal tray for hours while he's trying to keep up with stuff. And we need a better way of doing this. We need a better way of working with the families, of giving them privacy, of giving them respect, and a place where they can live with their conditions but not have their conditions define them. So this infusion center is incredibly exciting to me. I can see all of this coming to fruition where we can build a dedicated, safe place for kids to come in and get their infusions and spend their time with us in a very different way, where they can socialize with kids and families with similar situations and bond. And we've had such good bonding with our families, but also to have that opportunity to withdraw if they want to have privacy to work, both on their schoolwork and on the parents' work. And we've seen both of those things done during our infusion visits. So hopefully you can tell that this is a really big deal to me. I would very much appreciate anything and everything you can do to make this a reality for Connecticut Children's. Thank you.